study is more focused on the clinical trials. So our idea here was we have adenine that like a data set that you have longitudinal measures. So our question is cost effective? You use plasma biomarkers instead of neuroimaging biomarkers to across like clinical trials, like to track the evolution of the clinical trials, because we know that imaging it's expensive, and sometimes like you need hours of the patient there, you need to recruit. But we did two ways, like we calculate the cost, but first we calculate the sample size, and it's worth like you use the p-tau plasma p-tau 181 in clinical trials, but only in large clinical trials, because since it like has more fluctuation on the levels than when you compare to PET imaging, your sample size, like comparing both, is much huge when you use plasma compared than you use imaging. But like you have to think that like for imaging, one PET scan is between $3,000 $5,000 per individual, and you have the cost of the clinical assessment, and you have other costs included. And for the plasma, it's like $200 each test. So even though that you have like you need a much more larger sample size, still like the cost of the biomarker alone is it's lower than for the PET. But when you think like that you have to do baseline and follow up, imaging is still a little bit more cost effective than the plasma biomarkers, and you need less people. If we think about plasma biomarkers require a much more higher sample size, and this in the final cost of the clinical trial will be like more expensive than if you compare with imaging, because imaging require a lower sample size. But if you think about where you're doing this clinical trial, for example, in a place that you don't have access to imaging centers, you can like it's useful to use the plasma biomarkers. So the only thing you're gonna need like a larger sample size to track the longitudinal changes and to access if the drug that you're using is working or not. But it's more about like what you have, like how much money do you have? If you have like, can you access larger populations, like more people, recruit more people, or you just like you can use plasma. But like if you think, oh, I can't recruit more than like 2,000 individuals to do this clinical trial, it's still more useful to use PET imaging than the plasma. It's kind of sad, because in the beginning we thought plasma would be like much more cheaper, like way more like, oh, it's way more cost effective, easier to collect. But since we have these fluctuations on the plasma bigger than the PET, it increases your sample size, like so you can reach a final conclusion. But I think maybe in the future, with the developing of new biomarker, new assays, platforms that are more robust, and they think of companies are doing like recruitment are on the roads. So maybe they will be able like to reach a sample size that is good enough to perform with plasma biomarkers in trials.